grew up in Solihull, and then I moved to Newcastle where I did my basic surgical training for 3 years. And then I was lucky enough to get a place on the Oswestry higher surgical training rotation where I trained in orthopaedics. And then 10 years ago, I was lucky enough to get a place working as a consultant in Winchester, and I've never looked back really. I see a lot of patients with conditions affecting the knee, and that ranges from patients with sporting injuries through to traumatic injuries when people have had falls and fractures, and then through to degenerative conditions such as osteoarthritis, which tends to affect us in later life. So it's a real variety of presentations of patients that I see. Using the Mako robot for me, I feel it's an absolute game changer in the field of knee surgery. What it enables for me is to provide a bespoke procedure for an individual patient based on the alignment of the leg and also the balance of the soft tissues, and we've never really been able to achieve that before. We're able to produce a knee replacement which is much more individualised to the patient's own anatomy and biomechanics, and what we found is from day one people find it a more natural knee. So when people get up the next day, we get people out of bed, walking, bending the knee day one, and people will often say this feels more like a part of me. And what we're seeing is people really get going very quickly with it and are soon back into their normal activities, and we're seeing excellent results. I think what we're trying to deliver is a team approach, and that goes from the receptionist you first meet. It comes down to the domestic staff who are looking after you in the rooms and the environment that we all work in, to the nursing staff and physiotherapists. Everybody's got to be working together really to provide the highest possible standard of care for you. I feel incredibly privileged to do what I do. So I see people day in, day out in my clinic who are struggling even to walk short distances. They can't sleep at night. They can't do the things they like to do. They can't even get around the supermarket and do day-to-day activities sometimes. And what we can achieve is we can get people back on their feet, get people back into these activities and moving on with their lives and really putting it all behind them, and they don't look back.